Okay, so now what are the important points that you need to know about early onset neonatal seizures? So first of all, these are called as early onset because they initiate within 72 hours after birth. So within 3 days after birth or within 72 hours after birth, if the child is having seizures, they will be labeled as early onset neonatal seizures. So there will be fits, there will be a delayed cry, there will be tachycardia, tachypnea and feeding problems. So these all features will be present in a child of early onset neonatal seizures. Now what are the possible causes of early onset neonatal seizures? These include cerebral hypoxia, and this is the most common cause overall, cerebral hypoxia. And there can be intracranial hemorrhage, meningitis, any metabolic cause, for example hypoglycemia, hypocalcemia, hyponatremia. And the most common cause of early onset neonatal seizures is hypoglycemia, and most common cause of late onset neonatal seizures is hypocalcemia. So you need to keep this point in mind because it often comes as an MCQ. Okay, so there can also be certain inborn errors of metabolism and pyridoxine deficiency. So we're just learning the important causes of early onset neonatal seizures. Okay, and then cerebral dysgenesis and neuronal migration disorders, neonatal epileptic syndromes, Kernick Terrace or cerebral jaundice, drug toxicity, for example theophylline, tetanus neonatum, and benign familial syndrome. So these are the 10 causes of early onset neonatal seizures: cerebral hypoxia, intracranial hemorrhage, meningitis, metabolic causes, inborn errors of metabolism, cerebral dysgenesis and neuronal migration disorders, neonatal epileptic syndromes, Kernick Terrace, drug toxicity, tetanus neonatum, and benign familial syndromes. Now, how will you investigate a case of early onset neonatal seizures? These will include blood examination, for example CBC, CRP, blood glucose, urea electrolytes, blood culture, serum bilirubin, ABGs, ammonia, lactate, serum lactate. So all these are basically the different investigations that you're going to be carrying out in order to identify the underlying cause for neonatal seizures. Okay, so these are all the blood examinations. Then you'll order a torch screen for the possible infectious etiologies, CSF analysis for ruling out meningitis, CSF analysis and culture, ultrasound cranium to look for hydrocephalus, electroencephalography or EEG to look for tetanus neonatum or benign familial syndromes, and CT MRI of the head will also be done. So these are the important investigations that you're going to be carrying out. So just for an SEQ, these are the important past SEQ questions basically which I'm solving in these videos. So this was also a past SEQ, that what are the possible causes of early onset neonatal seizures and what are the investigations that you can carry out for that. So this was all about early onset neonatal seizures. I hope it was helpful for you guys.